Hi there, ladies. So happy to be here with Holly New Year and Patty Bomarito from Into Physical Therapy. Um, I have not talked about this very much on the blog, but several years ago, I got into a situation where I was experiencing something that no one seemed to be able to figure out what it was. And it was pelvic floor disorder. My main symptoms were frequent urination to the point where I got to just anxiety central and could not leave my house. And I went to many doctors around the Denver area, gynecologist, urologist, my primary care doctor, and went through so many tests over so many months until I finally went to a urogynecologist. And within 5 seconds, she said, you need to go to N2 and start physical therapy. And my life was able to return to normal. But so many women are suffering with this. And because it's kind of one of those things that can be a little uncomfortable to talk about, it kind of stays in a hidden state, if you will. And it doesn't seem like something that is as mainstream as it should be. I was told when I went to N2 a few years ago that in France, they actually offer this PT as part of a post-recovery from having a baby. So that tells you over there that it really is something that is recognized. But over here, it just seemed like I was going down a rabbit hole and couldn't find a solution. So I have Holly and Patty here today to talk to us a little bit more about this. And I'm going to have them introduce themselves. Holly is the owner of N2 and Patty is my therapist at N2, but they're going to tell you a little bit more about themselves and how they got involved in the pelvic floor arena. So Holly, I'll turn it over to you.
Awesome. Thank you. So I got involved in the pelvic floor arena when I was really quite young. And I took a job, not even knowing what this was, as a physical therapy aide. And that led me down the path of looking for women's health focused doctoral physical therapy programs, and then being fortunate enough to get accepted to Duke University, which had what I think was the top program at that time. And, I was initially drawn to how this population just wasn't receiving the quality of care, the recognition that I thought it deserved. And I started really heavily in stress urinary incontinence. That is when you leak, if you cough or you sneeze, and sort of found my career path as all of the therapists at N2 have, leading me towards more pelvic pain. But the bottom line is, this is a specialty that I think is really important to women everywhere. And like you said, France seems to be a little bit ahead of it. And I've found in my clientele, and I think Patty will say the same thing, that people do get a little lost in the system when I think if we just had that foundational education on pelvic floor, women's health, it could help women solve a lot of problems before they become really big problems. So, a job offer brought me to Denver. And then after being here for about a year, I was able to work with a couple women, start N2, and it's evolved into what it is today. So
awesome. Well, welcome. And Patty, tell us a little bit about you.
Sure. So my path to pelvic floor physical therapy is pretty unconventional. I actually worked as an engineer for a really long time before I returned to school to get my doctorate in physical therapy. And when you start physical therapy school, typically you take a really long course of anatomy as an introduction. And I had originally gone into PT school with the intention of working with individuals after amputations, because I thought, hey, I'm going to apply my engineering background and develop all this technology, and that's going to be my niche practice. And one of the lecturers we had in anatomy was in pelvic floor. And I thought I was a relatively well-informed female, really well-educated, health literate. And I thought, what is she going to tell me about pelvic floor that I don't already know? She came in and they gave her 45 minutes. And within 45 minutes, my mind was completely blown. I had no clue about my own body and absolutely no clue about what seemed to be a very vital component to everyday life. And so that led me down this path of wanting to know more about it. And I spent my winter breaks and my summer breaks chasing down local pelvic floor therapists and wanting to know more about what they did. And it just resonated. It was like, I knew this was where I needed to be. And so that was over on the East Coast. And I wanted to live near the mountains. So I moved out to Denver. N2 was the company that everyone told me about. And
Mhm.
I had this excellent job opportunity, and it was just the perfect lineup. And like Holly said, you know, we work with a wide variety of diagnoses, but really the primary thing that we work with is trying to increase this baseline knowledge that the population here has.
Right. Thanks. I know. I remember my first session with Patty, and she's like, "Yeah, I was an engineer." And I thought, wow, engineer to pelvic floor. That is a leap. But I'm glad that you found your place at N2. So Holly, tell us a little bit more about N2, the services you provide, what you see as maybe some of the challenges for this area, just, in general, what
Yeah,
you do and what are your challenges and how do you overcome those?
absolutely. And N2 has been around since 2011. So it has
Long
changed,
time.
it has evolved. It's in some ways become a very different business than it used to be. But what I think all of us at N2 really agree upon strongly is that we are so passionate about pelvic health, women's health, in essence, what is somewhat an underserved population. And N2 hopes to bring a team of people together. And that's something I think is very unique to us. And we provide services for female pelvic health, male pelvic health. My population has really gravitated towards generalized chronic pain because that should be viewed as the whole body. We treat postpartum, we help women through pregnancy. But in a nutshell, you know, we have this hardwired mentoring program. And I really believe as a business owner that you aren't going to get anywhere with the mindset of you are doing everything yourself. So N2 is very team oriented and works together and really just wants to help people, live their best lives as their best selves. I think that there are a lot of different providers and different approaches that kind of lead to this path. And I know Patty can chime in of, if you leak when you do it, quit doing it, or that is normal, or if you have pain during sex, then maybe you don't really want to have sex. And N2 exists to educate and empower people to have their best public health, their best knowledge, and just find a way to the life that they want to live.
That's awesome. Well, I can attest to the passion, and certainly I know that everybody, like Patty said, everybody that I talk to in this arena has just spoken so highly of N2, and just I felt immediately comfortable with what could have been an uncomfortable type of PT. I felt immediately comfortable with your staff, and it really changed my life. And I recently had a relapse, and that's how I came to Patty, and we were able to kind of fix me again within a few sessions. But I see N2 as being my partner possibly for the rest of my life, just because pelvic floor disorder does seem to sometimes come back and you need to do a little treatment. I see you guys as my partner, and helping with this, forever. So tell me, let's talk a little bit about what pelvic floor disorder is. What are some of the warning signs associated with it, so that women can kind of recognize this if it comes to them? And I don't know who wants to start. You guys can.
Patty, do you want to start? Do you want me to start?
You can go ahead and start. That's fine.
Okay, so there are so many warning signs I kind of teach it as pelvic floor problems. One of the best ways I think I can start this conversation is that your pelvic floor is a muscle that is responsible for a lot. And if we want to kind of simplify that, it's responsible for bowel, bladder, urinary function, sexual function. It assists in breathing. It contributes to our stability. And problems in the pelvic floor can lead to problems in the hip or the low back. So one way I try to teach my patients to look at it is if you feel like anything isn't how you want it to be within the functions of the pelvic floor, then we need to talk about the pelvic floor. So if you feel like, some women have a baby and come back to sex and it's kind of painful on entry, it's not a big deal, and their doctor said it'll go away, that's a warning sign. A flip of that is a woman who has pelvic floor laxity or weakness, and they say sex doesn't hurt, but everything feels rearranged. And hey, by the end of the day, I have a lot of pressure. That's a warning sign. So I like women to kind of view it as these are all things that you have every like right and ability to have working properly for you. So if there is something that bothers you, that's a warning sign. And then before I pass it on to Patty, the pelvic floor is so intimately connected to both our like somatic and autonomic nervous systems, our hip, our low back, our sacrum, and through that, really our entire body. So catching those things early can really prevent a lot of difficult problems in the future. So if you're not happy with it, talk to somebody about it.
Okay, and just to, before I turn it over to Patty, so just so that people can understand, so like for my specific situation, the pelvic floor was kind of pushing, because it was so tense, it was pushing up on my bladder and causing kind of a reaction that really wasn't real. I didn't really need to go, but because of this tension and this pressure, I felt like I had to go all the time. It wasn't a function problem. It was this pressure. Is that right?
It is right. And there's a million other explanations for that are right. And that's just evidence of how complex the pelvic floor is. And one of the things about that I love that you brought this up is a lot of women will go online and read that you need to be doing Kegels or pelvic floor squeezes. Right. But if you have that tension, tightness dominant problem, you have what you just beautifully described going on. You tend to get some nerve compression. The signals to your bladder can change and more. And doing Kegels is the last thing you want to do. So that's where getting help, asking questions, and getting the right solution is fantastic. And Patty and I see it all the time, where not only do people read it online, but like a medical office will say, oh, just do Kegels and it'll go away. And that can actually make the problem much worse.
And that did happen to me. Like I went online and I started doing that and it got worse. So Patty, tell us, what are there other warning signs that you've seen that kind of lead ladies or gentlemen to you?
Sure. I will add that so there are a lot of warning signs as far as pain is concerned. So that could be like pain with sitting, pain with pretty much any functional movement related to bowel, bladder, support, activity. So, we live in Colorado where it's a very active population. And one that I see a lot is people who have gone through the ringer as far as this hip pain or this back pain, this groin pain that just won't go away. And they have seen a sports medicine PT. They have gone through so many, a massage therapist and a chiro, and it seems to improve slightly, but it doesn't completely resolve. That would be someone where, okay, maybe it's coming from the pelvic floor. But with all of these disorders, dysfunctions, and problems, you need to be adequately evaluated by someone who's qualified. And that would be a pelvic floor physical therapist. Because Googling your way through it, just more often than not, isn't really teasing out the appropriate sequence of questions to really lead you down the right path. And so I see that one quite commonly, in addition to the bowel and bladder and sexual dysfunction.
Okay, thanks. So here's the tricky part. Okay, so I'm having this, I have Googled, it said, oh my gosh, you have urinary cancer, you have this, you have that, which is where, I go, unfortunately. So you go to your primary care, they say, go to a urologist. I mean, how for women that may be experiencing something, at what point do you think that there's some interject to say, wait a minute, you need to go to a pelvic floor PT? How could we reduce this time frame of when maybe you're feeling something to getting to you?
Yeah, that is a fantastic question. And I don't think that this is altogether widely known about PT. And I have to say, like, Denver has so many fantastic pelvic PTs, even outside of it, and too. So there's a great amount of resources here, but physical therapy is direct access. And into physical therapy, every physical therapist has a doctorate. and we have very good relationships with physicians. And I really do think if you have a sign of a pelvic floor problem, going to the physical therapist is a fantastic way to start and get the
Okay.
muscle evaluation. And then it sounds like your path was completely reverse of this, but I know that I spend a lot of time with people who come to me first and helping them build their team. And that team might
Right.
be, okay, you are experiencing a little postpartum depression. You need help with that. You need a sex therapist, or it might be urinary issues. You need a urogynecologist. We highly recommend this person. We've got a lot of great feedback. So I think that starting with a pelvic PT is actually a really good way to just get online on what is going on. And I will say that comes from a very biased position of I had 3 new patients this week who saw somebody that's not PT for 7 years, and now they're finally in the right place. So I think that as long as women can feel confident in talking, advocating for yourself, asking the right questions, and working together, that a pelvic PT would be a great place to start.
Okay. Do you have anything to add, Patty?
Yes, just that with direct access, you don't necessarily need a referral from a physician in order to see a PT, which not a lot of people know about, because they'll be like, oh, like it took me, several months to get with my PCP so I could get the referral to come to PT. And so it's great because here we don't have to do that. You could, like Holly said, come directly to PT, and we can help you build that network of healthcare providers. So you have this team, you can build this relationship, like you said, Hillary, for life, so that you always have someone to turn to.
Right. Great. Well, thank you, ladies. Thank you so much for being here. I am going to share all of your information as well as, a few tidbits about each of you. But I really appreciate you sharing your time with me today. And before we close, I just want to kind of say to anybody who is watching this is that if you have a friend who maybe sounds like they might be having some of these symptoms or warning signs and they're going crazy going to different doctors, please have them watch this so that maybe they will make their way to a pelvic floor PT before they spend, months going to different doctors, because I so wish that someone had said that to me during my little journey. And, it just, and I feel like all of the doctors I saw had my best interest at heart, but just for some reason, maybe the way I was describing it or whatever, it didn't click for them. So I guess the more we spread the word, the better, that this is a thing, and that, we have great resources to help us.
Thank you for
Thanks,
having us.
ladies.
Thank you.
Thank you so much. And I'll see you soon.
Okay. Bye.
Bye.